So health centers, as you know, are designed to address the barriers to healthcare access for the poor and underserved populations in the communities you serve. The Health Resources and Service Administration, known as HRSA, which oversees the health center program, requires all federally qualified health centers, both 330 funded and lookalikes, to conduct a community health needs assessment every 3 years. So what is a community needs assessment? The community needs assessment is the process through which your health center engages with your patients and communities to better understand their needs and assets in order to improve and inform the delivery of health center services. That phrase, to improve and inform the delivery of health center services, comes directly from the HRSA's Health Center Program Compliance Manual, which will be discussed later. The act and truly the process of assessing community needs, barriers to care, and community asset mapping has the potential to be transformative for both your health center and, most importantly, for the patients you serve. Engaging directly with your community and reporting and acting on those findings helps answer and inform the questions behind why you do what you do day in and day out. Specifically, through identifying needs and mapping assets, you are better equipped and informed to make decisions around your health center scope of project. This includes which services to provide, whether they are clinical services, non-clinical services, such as enabling services like transportation, interpretation, enrollment assistance, and outreach, or specialty services for which there is a gap in your community. The community needs assessment also informs where and when you need to provide services. Are there locations or sites within your community that currently lack access to certain services? Are there certain hours of operation that work better for your community based on the type of workforce or factors such as the age of your community? In addition, your needs assessment will identify care and service gaps that will impact what type of staff you need to either hire directly, contract with, or make referrals to in order to meet unmet need. For example, does your community need more dentists, behavioral health professionals, or medical assistants, or non-clinical staff such as health educators, interpreters, or enrollment assisters? These are some of the ways your needs assessment can inform the components of your health center scope of project. Identifying what services, locations, and staffing are needed will inform strategic decisions around funding, development, and financing. The findings of your community needs assessment may inform how you would pursue federal funding applications and opportunities, such as a HRSA New Access Point or NAP funding opportunity, or more targeted supplemental funding opportunities. It may be that there are services that your health center decides to pursue that fall outside the scope of project of your HRSA award. So you may want to consider seeking private philanthropic funding or other partner investments. Having your list of projects and estimated budgets and work plans will make you ready and competitive for these additional funding opportunities when they become available. There may also be services that you decide to provide that may be billable or create an opportunity for revenue generation through contractual agreements for service provision. This could potentially impact your payer mix, especially if there are services that aren't billable and may require a sliding or a nominal fee. So beyond funding, the community's assessment is an incredible opportunity to build trust and relationships within your community, which ideally is a sustained and continuous process of engagement as opposed to a one-off episodic one. This is an opportunity to engage with and provide outreach to specific subsets of populations within your community and your service area. For example, are there new immigrant or migrant populations with whom you should engage? Is there a growing number of young or elderly people moving into your service area that you should speak to? And within these communities, what are the unique barriers to care and health access that your health center needs to better understand? When conducting your needs assessment, it's important to connect with the other community organizations that are already on the ground, many of whom may be beyond the healthcare sector that serve your community. These organizations can be incredibly strong community assets and valuable partners. Great examples of these are faith-based institutions, schools, libraries, homeless shelters, food pantries, justice-based institutions such as police or jails, and even your local YMCA may all be community-based organizations that know the needs of your communities. Consider conducting key informant interviews with the leaders from these organizations. You may also consider partnering with these institutions when responding to your needs assessment. Now, speaking of community partners, it's important to know what other organizations within your community may also be conducting their needs assessments. There are several types of entities that are required to conduct community needs assessments. The two most notable types of organizations that conduct needs assessments are local public health departments and tax-exempt hospitals. It's not uncommon for health centers to partner with these entities on their needs assessments. Conducting your needs assessment can be a significant investment of both your time, money, and human resources, so partnering can help reduce a duplication of efforts and save your health center on the time and money you may need to invest in this process. In terms of requirements, nonprofit tax-exempt hospitals are required by the United States Internal Revenue Service, or IRS, under Section 501c3 of the Federal Internal Revenue Code. This was a requirement made under the Patient Protection and Affordable Care Act, also known as the ACA. And under this requirement, nonprofit hospitals are required to conduct their own community health needs assessment, often referred to as a CHNA or a CHNA, every 3 years. Hospitals must assess the demographics for the entire jurisdiction that they served, the social determinants of health, and the leading indicators of health and health disparities. Local health departments also conduct their own community health assessments, sometimes referred to as CHAs, and come up with their own community health improvement programs, also referred to as CHIPs. The requirements vary by state and local jurisdiction, but often are required to be conducted every 5 years for the service population of the local health department in their area. For more information, please refer to the National Association of County and City Health Officials website or www.nacho.org. Health centers are required to conduct their community needs assessment every 3 years. Your needs assessment must cover your entire service area and community, and your health center must identify the top causes of morbidity, mortality, and health disparities, access to care factors, and other factors that impact health or access to care. Now I'll turn things over to Avni to address how HRSA assesses compliance with the health center program requirements on needs assessment. Avni.